Guys, if you haven't already, you absolutely have to make sure for my brand new webinar called The 3-Step Method to Prevent Kidney Stones. In it, I share the top 3 mistakes that I see people make every single day when trying to prevent kidney stones. And of course, I'll share what to do instead. I'll also be talking about the exact step-by-step method that I've used to help hundreds of people stop kidney stones in my course, Kidney Stone Nutrition School. Make sure to register for this free webinar at www.kidneystoneclass.com. I cannot wait to see you there. Welcome to the Eat Away Kidney Stones podcast. I'm your host, registered dietitian and kidney stone expert, Melanie Betts. After learning a ton about kidney stones and helping people prevent stones at the University of Chicago, I was fed up with all the terrible advice people were finding online. So I decided to do something about it. The Kidney Dietitian was born. This podcast is for people who want to learn what actually works to prevent kidney stones and still enjoy life, eating, and their favorite foods. Let's dive in. I'm thrilled to have a super special guest on the podcast this week, Dr. Robyn Pashby. I actually met Dr. Pashby because we were speaking together at a diabetes dietetic practice group symposium earlier this year. And as soon as I met her and listened to her talk, I just knew I had to have her on the podcast. This topic isn't directly related to kidney stones necessarily, but I am sure that many of our listeners will find huge value and learn a ton from this conversation around weight bias, what that is, and how that impacts our health in huge, very significant ways. And so I hope that you enjoyed this very special conversation with Dr. Pashby. Hello and welcome to the 109th episode of the Eat Away Kidney Stones podcast. As always, I'm your host, registered dietitian and kidney stone expert, Melanie Betts, and I am thrilled to have a very special guest on the podcast today, Dr. Robyn Pashby. Dr. Robyn Pashby is a licensed clinical health psychologist and a speaker, educator, and writer. She owns her own health psychology practice in DC called Health Psychology Partners and serves on key national committees related to obesity care. She's also co-author of a book due for release in November of this year, so coming up in just a couple months, called The New Food Fight, which tackles the tricky topic of obesity and eating disorders, which is so fascinating. I cannot wait to read the book because I feel like people don't often see how those two things go together, and they so do.
They so do. Yes.
Yes. So welcome, Dr. Pashby, to the podcast.
Thank you for having me. I'm super excited.
Yeah. So I just, kind of read your official bio, but do you want to describe in more normal terms for the listeners of the podcast what exactly you do?
Yeah. Thanks. So first of all, I'm just a real person who has been basically interested in and working in the field of obesity and weight-related care for almost 2 decades now. And so I have a personal and family history of struggling with weight. And so it's been sort of in my ethos for as long as I can remember. And now what I've done over the last many years is really honed a specialty. So I have a PhD in medical and clinical psychology, which is, I would say, I like to describe it as sort of the intersection of mental and physical health. So people that are struggling with physical health problems often have mental health sequelae, anxiety, depression, things like that, and vice versa, of course. So people that have long-term chronic anxiety or mood disorders or other things tend to develop physical conditions. And I was really interested and still am interested in that intersection. So all day, every day, I see clients or patients, and I have a full-time clinical practice. But over the years, what I've learned is just after hearing story after story after story of sort of similar themes, I basically threw myself into advocacy and other areas of trying to help get the messages across to healthcare providers and basically anyone who will listen about the importance of really understanding what it's like to live with obesity, what it's like to access the healthcare system when you live in a larger body, and really trying to speak in a way that healthcare providers might be able to hear it so that they take a look at their own behavior and try to understand, okay, like I, took an oath of do no harm. I care about people. Is there something I'm doing that I can change that will help make my care better? So that's kind of how I spend the rest of my free time.
Yeah. Got it. Got it. So it sounds like you got interested in weight bias specifically because you kind of have that personal experience with it, both
Yes.
both personally and family,
Yes.
and just kind of really saw it impacting care for patients that you were working with.
Yes. And I mean, how many times can you sit with a person and hear them say, oh, like my hip has been really bothering me for the last 2 years, but I don't dare go to an orthopedic specialist because I'm afraid that they're just going to say lose weight.
Hmm.
Or I haven't had a woman living with high weight might say, I haven't had an annual gynecological exam in 10 years because I'm
Hmm.
too ashamed to go on the
Yeah.
table. And when you hear these stories over and over again, there's just only so much, at least in my world, I was like, I have to do something about this.
Yeah.
And
Yeah.
so hence
That's
was
a good
born the
segue.
rest of it.
Yeah,
Yeah.
a good segue into a question I was going to ask later, but I feel like it fits now. I know, and you know, I'm sure way better than I do, there's actual data that shows that people living in higher weights have negative health outcomes because of the weight bias that they experience. So can you talk about that a little bit more?
Yes. So what I think what you latched onto there was the delay in care. And so we do see that. I mean, that's borne out time and again that people living with higher weight tend to delay their own healthcare access, right? And these are, I mean, many of the times I live and work in Washington, D.C. I have a lot of people with big jobs or, lots of education and things. And these are people that know that preventive health screenings and other things are important and they recommend them to their families and they make the appointments for their family members, but then avoid it themselves. And so the data really does bear out that delay of care is a huge issue. But then also, I mean, if you want to get, a little more rare, but really big impact, there's also misdiagnoses that happen because of weight or just lack of examination. So many people will report things like going into a physician's office and leaving having never been touched when they're there for an orthopedic issue or something that in theory would require a physical examination, right? And so there are plenty of data that reveal that weight bias shows up in exam rooms and then and outside of them, right? Even before people walk through the door.
Right, right.
Yeah.
There's almost three things to think about, like the weight bias. And I want to back up and define why weight bias. We missed that. So we'll
Yes.
do that. But we just had such good stuff. I wanted to jump on. So I feel like people living in larger bodies experience bias in our culture, which we can certainly talk about, right? And
Yes.
that is prevalent everywhere you go and in every interaction with practically everyone in your life.
Yes.
And then also from a health standpoint, there's this delay of care, which you talked about, right? It's just uncomfortable to go to the doctor because they're just going to tell you to lose weight, and that's just not
Yes.
fun. You've been
Right.
telling me this for decades.
Right.
And then also, doctors will often, and not just doctors, all healthcare practitioners will assume, oh, this is an issue just because of your weight. So instead
Yes.
of really diving into what's really going on with, say, an orthopedic issue or any issue, a GI
Any issue.
issue, right?
Yes.
Someone will say, oh, well, you just need to lose weight, and that's the issue. Whereas if that person wasn't in a larger body, they might do a little bit more digging, run some more tests, feel their bodies, right?
Yes.
Do a bit more examination to see what's actually going on. And lo and behold, it may not actually be related to living in a large body. Many of the times not. So,
Many of the times,
mhm,
right? And I think you're right. Like it's so spot on that these are, it's not like weight has nothing to do with a host of medical conditions. I don't want to overstate that, right?
mhm,
But that identifying weight as a singular and only cause for basically everything from the common cold to a broken arm is
mhm,
just sort of by definition weight bias. If you want to
yeah.
get back to
Yeah,
defining
let's
one,
define it. Okay,
right?
what is the definition of weight
Yeah.
bias?
So, I mean, there's lots of definitions out there.
Yeah.
I love the Obesity Action Coalition's definition, which I'll paraphrase, but is basically like when people hold beliefs, ideas, and ways of viewing people that are solely based on their weight and that are stereotypical, judgmental, and so forth. So, believing that someone living with obesity or living in a larger body is, let's say, I can list a bunch, is less smart, is less motivated, has less self-control, is lazy,
Less
is
healthy.
less healthy, right?
Mhm.
All of those things. So those are all examples of what weight bias is.
Yeah.
Yeah.
Um, So, can you comment? Because I thought this might be interesting, because I feel like there are many different types of discrimination that we are used to talking about: racism, sexism, ageism.
Yeah.
How would you say, like, what are the first things that come to your mind when I say, how is weight bias, weightism, is that a word?
Some people think so,
Okay,
yes.
okay, I'm not sure. But
Sizeism is usually the word that's used.
what is it?
Sizeism
Oh,
is
sizeism. Okay,
often.
I've not heard that
Mhm.
before. Okay,
Yep.
sizeism. Because I suppose it could go either way too, right? People in very small bodies, you make assumptions about
Oh,
them as well.
oh, of
So
course.
anyway,
Yeah.
but how is this whole topic that we're talking about different than racism, sexism, ageism, right? Because these are things most people, I would say, acknowledge exist in the world.
Acknowledge exist,
Um,
right?
yeah, maybe I should retract that statement, but these are generally things that we think are bad and we are trying to fight against. But how is this different?
So my gut reaction, I'm not an expert in any of those other things, just to be clear, but my gut reaction is that they're actually really connected. So we know, I mean, I won't go into the long history, but I'm sure people understand that there are some racial overtones around BMI and other things in terms of like historical
Hmm.
developments. And so that is important and we shouldn't eliminate that. But we also know that experiences with racism, with sexism, with ageism, et cetera, are traumatic experiences that can contribute to someone, for example, using food to cope or experiencing depression or other things that can over time contribute to weight gain. So I
Hmm.
would say that there's like causal mechanisms from one ism to the next.
Yeah.
Also, what we know is that they both like say racism, sexism, and so forth, and weight related bias and stigma affect health disparities, right? And contribute to health disparities, disparities in care, disparities in access to care. So, I mean, I'm sure there's many ways that they're different, but I see them as very similar in terms of their interconnectedness for the real lived human experience.
Hmm.
Now, we know that culture affects how people view bodies and right and how someone living in Asia might view a body is different than how someone living in Canada might view a body, for example, and that's okay, that's a cultural thing. But I do think we have to understand that sometimes in different cultures, people still experience bias, right? Even
Hmm.
if the cultural norm is to be more accepting or to be less accepting, that
Hmm.
there's still bias inherent in like size, with body shape and size. And your point is really important. I mean, because of my work in the obesity or weight related world, I tend to talk about that. But I want to be really clear that people living in smaller bodies or other bodies that don't fit whatever we have decided is the norm, average, whatever,
Hmm.
also experience that, right?
Yeah.
So people assume basically in our society that thin is healthy, right? And that healthy is thin,
Yep.
but not too thin. Don't be too
Hmm.
thin,
Right.
right? So there's
Especially
all
women.
these, especially women, right?
Yes.
Although men, I would argue men too.
Mhm.
And so I think there's just this whole idea that your body is a reflection of your health status is
Mhm.
really pretty much the problem.
Yeah. Yeah. I'm reminded very much of Wicked came out this year, late this
Yes.
year, right? And I feel like there was so much commentary
Oh,
on Ariana Grande's body
yes.
because she looked too thin. And like that was just like all over social media, that was just like such a topic of conversation and such a distraction from the amazing performance that she gave in Wicked, right?
Well,
It was just like an
especially, and
example.
I took my 10-year-old daughter to see that movie. And as we were leaving, she and I had a discussion about what is it actually about, right? And I think that the whole green skin commentary was a major social commentary on not
Yeah.
judging people based on how they look, right?
Mhm.
And then that the
Absolutely.
whiplash is that that's exactly what happened is sort of
Of course.
irony at its best, right?
Yeah. Yeah. The one very big difference that comes to my mind when we're thinking about the different isms and sizeism is that it is perceived by both the individual experiencing the discrimination as well as the culture that we live in, healthcare practitioners as well as other people, that it is changeable, that
That
it's
it's in your
modifiable,
control. Right.
right?
Right.
Um, and we could have a whole different discussion about whether that is the case or not, because
Right.
there's really not a lot of data that shows that weight loss efforts are very effective. And when you think about simply changing the number on the scale, but that's another conversation. Um, but like that, I think gives this less, I fear that it gives this less, what's the word I'm searching for? People will see like, oh, it's not as serious because they can just change their bodies, right?
Right.
You can't change the color of your skin. You
Right.
can't change your sex in
Right.
right generally. But like,
Right.
so
Yeah.
I don't know.
I
What do you
think,
say to that?
well, I think that ties right into North American ideals of sort of self-determination and self-control, right? That
Hmm.
if you just work hard enough, you will achieve X, whatever X is, right? It's
Yeah.
like that American dream. And so I think we've
Not always.
turned that into um, penalizing people
Hmm.
for whatever reason, economic ladders, social ladders, physical status ladders. Like if you
Hmm.
don't achieve what is considered the ideal, then it's because you didn't work hard enough. And
Hmm.
that is certainly unique to issues around body shape and size because of this perception of self-control
Yeah.
that's involved. Yeah.
Yeah. Why are people so mean?
I
I
know.
feel like people like this is it's just so upsetting whenever I talk about these things because it's so true. And I've specifically the weight bias thing, because as a dietitian, this is something that's obviously very much part of my education and my like right my actual like learning right when I was in college as well as my continuing education now. And it's just something like we sort of like dietitians generally know exist, but it's not discussed. And it's so prevalent and it
Yes.
just isn't seen as big of a deal as racism or sexism. And you can't say one is worse than another, but I would say this certainly has a fighting chance at the table, you know?
For sure. Well, and I think we should be clear that a lot of the isms that you just talked about live in real people that have a lot of intersecting identities, right?
Certainly.
So
Hmm.
there can be a person with a lower income who lives in a body of size who is a woman of color or something like that, right? Who is experiencing all the isms.
Yeah. Yeah.
And
Who
so
live
that is
part of the
obviously
LGBTQ community,
right,
right? Like,
exactly. And
yeah,
so
you could go on and on.
these sort of
Hmm.
pile on top of each other also.
Hmm.
That's the part where I think they're sort of inextricably
Yeah.
linked to one
Yeah.
another. Yeah.
Absolutely. Do you have any more commentary? I'm going to kind of jump forward, and we already touched on this, but any more to say in terms of how exactly weight bias impacts health? Because I feel like that is kind of the topic of at hand today is
Yes.
helping people understand exactly how weight bias, both in our culture as well as from healthcare practitioners,
Yes.
makes people less healthy.
Yes. So let's
Yeah.
start with which we already talked about briefly, but with healthcare providers.
Hmm.
We know that if people delay care or delay seeing, for example, a dietitian because they don't want to be told to eat celery instead of chips or something, right? Which is like sort of the classic thing that people fear they will be told
Hmm.
by a dietitian.
Yeah.
Um, they delay care. And so then they can't access the amazing support opportunities available to them. So just that alone increases people's risk of developing more chronic health conditions over time. And that, of course, that contributes to them developing mental health conditions because it really is hard to live in a body that is not doing what you expect it to do, right? Or
Hmm.
is hurting all the time, like
Yeah.
chronic pain issues, these things. Then in society, when we talk about like what does experiencing what I call microaggressions around weight, some of them are very obvious macroaggressions, downright abusive experiences, but a lot of them are subtle, right? You walk into your doctor's office and there is not a chair that will fit your body.
Hmm.
You buy a ticket to a performance at a play and you can't sit in one of the seats. These are not, it's not like a person necessarily doing it to you, but it's society sending you a
Hmm.
message that you don't belong.
Hmm.
I once gave a talk at a very well-known fitness club, and I was talking to all the fitness trainers there about weight bias. This is many years ago, over a decade ago. And they were so engaged and so excited and so ready to listen. And then we ended our talk by walking up into their storefront at the front of the gym. And the largest t-shirt they had was a large. And I said, for example, right, if a person living in a larger body comes to the gym and is
Hmm.
feeling good about themselves and wants to wear your brand logo out in the street, they can't.
Hmm.
And it was just this moment of sort of stunned silence among the team, right? Like they hadn't even considered that.
Hmm.
So another way that social bias affects people's health is places where people would go to work on their fitness.
Hmm.
Not a very safe place, right? Number one, it's full of mirrors, and we all have internalized weight stigma and bias that we have to fight against and work on, right? A lot of people don't want to exercise in front of top, floor to ceiling
And why do
mirrors.
they do that? That's such a good point.
I mean, like,
It's miserable
right?
for everyone.
It's
No one
miserable,
looks good
right?
while you're working out. You're sweaty.
Exactly. Exactly. And
Yeah.
well, and even just like the fear of sweating, because
Hmm.
if
Yeah.
if you live with obesity and you're considered to be unhealthy, then the last thing you want to be, doing is caught sweating, right?
Hmm.
So, some of my clients will say things like that. So another place that it shows up is affecting people's ability to exercise. I have people that will only exercise in their neighborhoods at night after dark because they don't want to be seen trying to get healthy because they're like, well, then people will judge me and be like, oh, well, you should try harder or what, or
What
open up
a
a conversation or things. So, um, it's really only been recently, you probably know this, that fitness companies have made exercise apparel readily available that comes in a variety of sizes. So
hmm
even if someone of size wanted to exercise a decade ago, you had to go on a hunt to find exercise clothes that fit your body, right?
Yeah.
So these are sort of the like unspoken ways that these microaggressions tell people. And what happens over time when you experience chronic microaggressions that tell you you are not good enough, you do not belong here, you are not welcome here, what do we expect in people's health and mental health, right? We know that the chronic cortisol activation of experiencing chronic stress over time affects every organ in our bodies, right?
Mhm.
Cardiovascular health, our immune system and function, all of these factors. So we know that that is a contributing factor to chronic health conditions, to mental health conditions. And then, of course, when people sort of withdraw from society to be self-protective, they
Mhm.
don't access social support, let alone medical care, right? And so it just like all the layers, it's almost like weight bias is woven into the fabric of people's health. In you can't even really pull it apart, right?
Mhm.
Because so many little factors influence the health behaviors people do or don't do, the ways they talk to themselves, the
Mhm.
ways they see themselves operating in their business or in their families
Yeah.
or in their communities. It's
Yeah.
just, oh,
It's like if you think about every single little thing you do when you wake up, it could be impacted by weight bias, right? You wake up and you think, "Oh, my shoulder hurts today. Oh, it's probably because I'm in a large body.
yes,
Oh, now I have to go have breakfast. Okay, well, I should eat this. I shouldn't eat this because I'm in a larger body.
yes.
Okay, I'm going to go put
Gotta
on
go get
clothes, and this is a
dressed.
very stressful thing
Yes,
because every single day because I don't feel comfortable. I can't find clothes. I can't afford clothes or no matter what I put on my body, I'm not going to feel good, right? And you could just keep on going
yes.
through someone's entire day.
So I actually gave this exact example at a talk at Obesity Week,
Oh,
which is like the Obesity Society's national convention about 3 years ago, taking it from the minute your alarm clock goes off, which
hmm
starts the first thought in your mind is like, oh, I didn't follow through with my plan yesterday or whatever,
hmm
right? I shouldn't
Yeah,
have, all the way through the last thing at night, which is like, okay, here's what I'll do better tomorrow, or I'll
yeah,
be better tomorrow, or something. Every single moment. Do I have that food? Do I not have that food? Right? Is this shirt going to fit me? Is this person looking at me? I have to stop and get groceries on the way home, but I don't, I'm embarrassed about what's in my cart. I saw that person looking at me.
what even
Just
should I be eating,
what should
right?
I be
Like,
eating?
yeah,
Right.
period.
Exactly.
Yeah.
Yeah.
I want to highlight a comment that a statement that you said, I'll be better tomorrow, because I think
Yes.
that's such a great example of how all of this stuff elevates to I'm a good and bad person.
Exactly.
Just like I talk about like the morality of food. There is no morality of food, right? Like you ate chocolate cake, that doesn't make you a bad person. Like
Right.
killing someone maybe makes you a bad person.
Right.
That's a bad thing to do.
Right.
Eating chocolate cake is not.
Right.
But when you live in a larger body, that those lines get very, very blurred and it's impossible, right? I was good yesterday. I was bad yesterday. I'm going to be better tomorrow. And it puts this morality on yourself
Yeah.
based on what your body looks like.
And I think, when we ask, I hear a lot of really well-intentioned medical providers say things like, well, if people would just do like what we tell them to do, or this sort of thing.
Which
And
isn't even necessarily true, for the record.
for the record, correct.
Yes.
Again,
But
well-intentioned folks, right? And
yes.
I think about it like, Right. But imagine if every single decision you made felt like a decision about, am I a worthwhile human being or not? Right. It's like you make one wrong move and, well, it all falls apart. Right. I
True.
mean, and so
Yeah.
kind of like, why would I even bother if
Yeah.
I already live with weight issues? So obviously I'm already,
A
as
bad
people,
person.
right, a bad person.
Mhm.
So like, why bother?
Yeah. And not to mention that thought pattern of just go lose weight, just do what we tell you.
Yes.
Um, Again, kind of back to my point, even if right person A and person B does the exact same thing, chances are they're going to have a different body size.
Yes.
And that also completely ignores resources to
Yes.
access gyms, have money to access healthier foods, minimally
Yes.
processed foods, to cook, to know how to cook, to have time to cook. I have twin, almost 3 year olds, and my diet looks very different than it did prior because I have no time and I'm constantly like overstimulated, right? Like,
Yes.
so
Yeah.
it's um it's just such a disgusting, if I can use that word, oversimplification of what
Right.
human lives and behavior are like.
Exactly. So here's the thing though. I circle around this question all the time because how do we get people who don't think like you and me to
Yeah.
understand that, right?
Hmm.
Because I don't I know you said like this sort of feeling of just like why are people like this, right? And I actually really sit with that question. Like
Hmm.
why do people struggle to see weight bias as a real issue?
Hmm.
Why do people who theoretically really care about other people's lives and health and well-being continue to persist with this idea like just do this and you'll be fine or just don't do that or like what is it that gets in the way from really thinking about another person's lived experience and why can't that matter to people?
Man, the big question. Do you have an
It's
answer?
no, I don't. But if you do, I'd really love to hear
No.
it. But I guess I would challenge our listeners
Hmm.
to ask themselves, right? Like if their initial reaction to a discussion of weight bias is like, psh, right? Probably that's not going to be your audience. But if it were, right, like that doesn't matter or that's not that big of a deal, maybe like take a minute and wonder if people who align with you on so many other things, right? Like we all want to be helpful in the world. We all care about people's health and well-being are telling you this and giving you example after example after example of why it matters. What is stopping you from hearing that and
Hmm.
from looking at your own behavior?
Yeah.
You know, and I think one of the things that I work really hard on is not to judge the people who are inadvertently using bias, and because that doesn't do us any good, right? It doesn't
Hmm.
do any good to shut down people by being like, don't do that, you're bad. Because then we're just literally doing what we're
Exacerbating
telling
that
people not to
cycle.
do,
Hmm.
right?
Yeah.
So instead I ask us to like be reflective, self-reflective, and think about, there's lots of reasons that this bias persists. And a lot of it is like fear. A lot of it is really thinking like, but if I know the people think like, if I know the right thing to do to help this person lose weight, I want them to be healthy. I just tell them what to do and they should do it. Right. I don't think that that's malintended a lot of the time.
No.
So what's going on? Like
Hmm.
what's getting in the way? No,
Not understanding the complexity of health, and health isn't just body size. Like it's just so ingrained in our
it really is.
culture from historical context to your point
Yes.
earlier, right? It's just it's so difficult for people to understand that you can be healthy and have a BMI that doesn't fit into our tiny little range, right? Um, and in fact, it could be unhealthy to force your body to go into that tiny little range. I don't know, but I'm sure you could answer that question from a
I
gazillion
know.
different
It's
angles.
so
That's the
it's
first thing
so
that popped in my head.
complicated. I always hope that after listening to a discussion like this, that people just ask themselves, well, like, what do I really think?
Hmm.
Right?
Right.
What do I do when I greet a patient that might be perceived as bias, right?
Hmm.
What do patients walking through the door, clients walking through the door to see me, how are they going to read my behavior, whether or not it is biased? Because there's a whole area called like anticipatory weight bias, where you don't even have like, so I registered dietitians are very vulnerable to this,
Hmm.
right? Because through history, your profession has been labeled as kind of biased, right? And
I'm sure we are.
yeah,
Yeah,
and
yeah.
like outside of the dietitian world.
Hmm.
And so I've worked with many amazing dietitians who totally understand it.
Hmm.
But I think trying to talk a client into seeing a dietitian, they're like, yeah, but they're just gonna tell me to lose weight, or they're gonna judge me for like, eating chips at 10 p.m. or whatever. I'm not gonna show them my food diary. I'm too ashamed of it. And I'm not pretending that's something that the person, that dietitian has done or said,
Yeah.
but it's the anticipation of that bias.
Hmm.
So if you know that even if you're a person that doesn't operate from a biased standpoint, if you know that the person walking through your door might be anticipating that you do,
Hmm.
that also calls on you to make some adjustments to how you interact, right?
Yeah.
Call it out and be like, maybe you were worried about showing me this.
Yeah.
Or, and like just having that conversation transparently makes everything so much easier.
Yeah. I don't know if this is another example of anticipatory bias, but as you were telling that story, I also thought, um, I know that doctors have told me that they maybe are less likely to refer patients in larger bodies to a dietitian because they assume that they're not going to be interested. So I help people prevent kidney stones, right? And so there's a lot of things that we can do, regardless of what body size you are in, to prevent stones or improve your kidney health. But a doctor may be less likely to send you to see a dietitian because they're like, you're not interested in healthy eating, right?
Those assumptions are yet another way that bias is impacting people's health,
Hmm.
right?
Yeah.
Because even just not giving the referral
Right.
is such a great example
Right.
of that.
Changing care, which goes back to what we
Yes,
were talking about before, not digging deeper into all the possible
exactly.
causes and treatments.
Yes, exactly.
So, most of my listeners I know on the podcast are patients, but I know I do have quite a few dietitians specifically who listen to the podcast as well. So I want to close with what each of those groups of people can do. So we'll start with dietitians slash other healthcare professionals. If this is something that you either is new to you or something maybe that you feel passionately about, what can you do in addition to your wonderful advice of looking at your practice, like looking at the chairs that you have and like those types of things?
Mhm.
Um, what else can we do to kind of help this cause and help get more attention on this super important issue?
Right. So I'm on the board of the Obesity Action Coalition, which is a patient advocacy organization,
Okay.
and they basically are experts in weight bias, and they have so many available free resources for healthcare providers of
Okay.
all kinds. So just go to obesityaction.org,
I'll
and
link it.
that's a great place to start. It's like from the privacy of your own home, you can kind of go through and read a bunch of articles, watch a bunch of free videos,
Hmm.
and even they even have materials you can order that they will send to you that you can put in your office, like if you have a physical office. So
Yeah.
they have lots of available cool things.
Cool.
We
I did
also
not know
have,
that. That's
yeah.
awesome. Hmm.
And actually, we have like in-person regional events and other things mostly free for patients. So that's a really cool place that
Yeah.
providers can go. Um, the other thing is just really looking at the way you would, again, going back to your question, if you suspected that you held racial biases or other things, my guess is you would be like, you know what? I need to like read something about this or attend a continuing education class focused on that or something.
Hmm.
Maybe just do that, right? Put weight bias on your radar that way from a curiosity standpoint. So,
Hmm.
like, okay, what can I attend? What can I listen to learn more?
Yeah.
Uh, from a patient point of view, again, going back to the OAC, we do a ton of free events for people. And so I would highly encourage patients listening to become a community member. It's an amazing group of people. But beyond that, I would say learning self-advocacy skills is a really cool and empowering thing. And so a lot of people that I will work with want almost like they want to sort of practice a script before going into seeing a healthcare provider because what I hear a lot is like, I want to be on the offensive rather than a defensive.
Mm.
So if I go into a healthcare provider's office, I might say something like, yeah, I know I've gained weight because I don't want the doctor to say or the
Bring
nurse or
it
the
up
doctor to
and
say like, well, you've gained some weight, right? It's better to sort of put it out there up front. So I encourage people, though, to think about an articulate way before you go into a healthcare setting where you can say something like, my weight has been a struggle my whole life. Here's what I've been doing to work on it.
Mm-hmm.
Or, like, I'd rather not talk about my weight today. Or I'd rather not get weighed today. Is it
Or
medically
get weighed backwards. Or,
necessary?
yep. Mm-hmm.
Right.
Yep. Mm-hmm.
So learning those self-advocacy skills, it's exhausting, and I hate that people have to do it, but it's sort of like the best temporary stopgap we have until people
we get rid
can
of weight bias.
yell from the rooftops that this is a real thing that affects every healthcare interaction.
Yeah.
And by the way, those self-advocacy skills work in families and in marriages and among siblings and among best friend groups and among church communities and you name it, right? Because bias does not only happen in medical exam rooms. So if you need to tell your mother or your sister or your father or your husband or your wife or whatever that you need to have more privacy around your weight, or you don't want their comments about your weight,
or what you're eating,
right, or what you're eating, or to give them very explicit examples of how they can support you rather than having them make assumptions about what feels supportive to you. These are all little ways that people can set a few more boundaries for themselves and start to, as I always say, like start to reduce those cortisol hits from all of those sort of negative inputs, right? And the less cortisol we have, I don't watch horror movies for a reason. Like I have enough cortisol. I don't need any
not
more.
Good for your blood pressure.
Right, exactly. So, but those are some small steps that people can take.
Yeah. Yeah, that's great. And and I agree. I hate that people have to do that, but unfortunately, we live in a world where weight bias is probably going to be here our whole life. And so these are things that you can do to make life more comfortable for you, navigating the world.
And find support, right? There are so many good organizations, support groups, therapists like myself, other people out there that have like real experience in this and can make a difference in how you feel about not just your weight and your health, but like your relationships. Because if weight bias is at play in your relationships, it's affecting the quality of those relationships.
Are there any tools specifically from the Obesity Action Coalition? Was that the name? In terms of finding those practitioners, because that's a question that I get a lot when I'm talking to people about maybe trying to find a weight neutral dietitian or doctor. Is there like a database or some way to find?
There actually is. We are working on that.
Oh, awesome. Okay.
Yeah, it's like called an Obesity Care Providers Network, and it's not perfect yet, but it's coming together.
Okay, awesome.
As a way of finding practitioners out there that understand the complexity of weight, basically.
Yeah.
And by the way, I want to be really clear. It's not a bunch of weight loss providers. Okay. It's a bunch of people treating weight health, essentially, and health as it relates to weight. So, and that can
whole
be
health, not just mental health. And
exactly.
Yeah. Awesome. Well, thank you so much for your time. I had so much fun. This was such an important conversation. And I know that many of our listeners will get a lot from it. So if people are interested in connecting with you through any of your channels, where can people reach you and find you?
Yeah, so probably the easiest place is just my practice website, which is Health Psychology Partners with an S.com. And any message that goes through there comes to me. So that's the easiest way. But I'm also on Instagram and Facebook at Robyn Pashby, PhD.
And I'll link to everything so people can easily find you.
Right. Oh my gosh, I need to brush up.
I know it's hard to remember all the different. Yeah, awesome. Awesome. Well, thank you again. It was a lovely conversation. And maybe we'll have you back to talk about updates and weight bias in healthcare.
Thank you for
in a couple
having
years.
Me.
Yes, thank you. Bye.
Bye.
All right. Awesome. That was wonderful. Thank you.
So much fun.
Thank you for listening to today's episode. For more help with kidney stones, check out my website, www.thekidneydietitian.org. For more personalized help from me, check out my online course, Kidney Stone Nutrition School. VIP enrollment includes help directly from me. I can't wait to see you there and help you prevent kidney stones. Have a great day.